Good afternoon. My name is Alma, and I want to share information about the rise of cybersecurity threats in healthcare. Hospitals and clinics are trusted to protect both patients' lives and private information. As technology grows, so does the risk of cyber attacks. These attacks are now one of the most serious problems facing healthcare. Cyber attacks in healthcare target many groups. They affect hospitals, doctors' offices, insurance companies, and even small labs. These criminals use different methods to break into our systems. One of the most common is ransomware. This is when an attacker logs in a whole computer systems and demands money to release them. They also use phishing emails to trick staff into giving away passwords. Once attackers get inside, they can steal records or shut down important systems. The number of attacks has been increasing over the last 10 years. They are not limited to one area. In the United States, there have been many large breaches, but hospitals in other countries have also been hit hard. In 2024 alone, the FBI reported that cybercrime losses reached more than $16 billion in all industries or across all industries. Now we don't really know what may be coming in the future. Healthcare is one of the hardest hit because the systems are so critical. When hospitals are attacked, it's not just about stolen data. They don't just steal data, right? These attackers can delay patients' treatment. They can cancel surgeries leading to death. You know, when an accident happened, they may send ambulances to other hospitals or other locations, and all of this because of miscommunication or because the system has been attacked and the attacker is just manipulating it the way he wants to. The impact on patients is very serious. Medical records containing PII, personally identifiable information, can be released. There's a lot of, insurance information, social security numbers, I mean to say, and even food health history. These are things that we're not supposed to see in the public. These are things that are not supposed to go out. But when an attacker attacks, this is the risk of what the healthcare company will lose. When these records are stolen, people are at risk of identity theft and fraud. The cost to fix these breaches is also very high. According to research shared in JAMA Network Open in 2025, ransomware attacks were responsible for exposing millions of patients' records over the last decades. These studies showed that these attacks are increasing and the problem is really, really, really far from solved. How do criminals succeed? In many cases, attackers get in because systems are not patched. That means updates are missing and software remains weak. Sometimes staff members click on fake emails without realizing the danger. Other times, criminals break in through third-party vendors that connect to hospital systems. Once they are in, they move from one system to another until they control the large part of the network. Healthcare organizations are trying to fight back. Many now use stronger backups that cannot be reached by attackers. Others use multi-factor authentication, so stolen passwords are not enough to break in. Hospitals also are training their staff to spot suspicious emails. Government groups like the FBI and the Department of Health and Human Services have shared guidance to help facilities protect themselves. So I want to say that cyber threat in healthcare, is growing very, very rapidly. These attackers put patients at risk and make it hard or harder for doctors and nurses to provide safe healthcare. By understanding how attack happens and why they matter, the healthcare industry can be better prepared. The rise of cybersecurity threat in healthcare shows that protecting data and protecting patients now goes hand in hand. So we need to do more to see that we fight these attackers. We give hospitals or the staff better training, and we caution them not to hit on emails that do not have, or I mean, like emails that can be considered suspicious, you know, and yeah, with doing that, we can be rest assured that our nurses and our doctors will treat our patients in a very safe condition.